Hello everyone, I hope all is well. My name is Gabriela and my work is titled Low Birth Weight Induced by Maternal Malnutrition, Prejudices, Phagocytic Activity of Alveolar Macrophages and Increases Susceptibility to Infection. Maternal food restriction during pregnancy induces morphological and metabolic fetal adaptations and predisposes to metabolic diseases include diabetes and hypertension. Metabolic disturbance can also be induced by the imbalance of pro and anti-inflammatory factors, as observed in previous studies. Your group demonstrated that food restriction during pregnancy resulted in low birth weight, hypocellularity in bone marrow, and peripheral blood, reduction in leukocyte migration, attenuated allergic lung inflammation, and a defective inflammatory response in Western rats at 12 weeks. The aim of this study was to evaluate the influence of maternal malnutrition during the pregnancy on the development of sepsis in adult offspring. And for this, we have used the following methodology. Timed mating was carried out in age-matched female and male with day 1 of the pregnancy was defined was the day on which spermatozoa were detected in the vaginal smear. After confirmation that mating had occurred, female rats were randomly divided into two groups: nourished with diet and water ad libitum, and malnourished with 50% food restriction and water ad libitum. At 12 weeks of age, male offspring rats from both groups were submitted to cecal ligation and puncture (CLP) or submitted to shell operation, and 6 hours after, the animals were euthanized and the inflammatory parameters were evaluated. It was evaluated temperature and glycemic levels in blood and creatinine and urea in urine. The cytokines IL-1 beta, IL-10, IL-6, MIP2, and TNF-alpha were evaluated in serum and lung tissue. To assess phagocytic activity of alveolar macrophages, these cells were incubated with yeast and were counted after 2 hours. Well, your group demonstrated that food restriction during pregnancy resulted in low birth weight, but with 12 weeks, this offspring, low birth weight, observed increasing in weight. Similar hypothermia and hyperglycemia were observed in both groups submitted to sepsis protocol. In addition, increase in creatinine and urea levels was also observed in these groups. Corticosterone levels were high in groups submitted to CLP, and these results are particulars of sepsis. Although in low birth weight control group observed corticosterone levels higher than the normal birth weight control group. When evaluated the cytokines, we observed in serum and lung the similar standard. The cytokines IL-6, IL-1 beta, and IL-10 levels were enhanced by sepsis protocol in both groups. The levels of these cytokines were higher in low birth weight than in normal birth weight group. The count of colony-forming units (CFU) in the peritoneal fluid in groups submitted to sepsis was significantly higher in low birth weight when compared to normal birth weight group. Low birth weight group showed defective phagocytic activity because the number of phagocytes yeasts by alveolar macrophages is lower than normal birth weight group. Also observed, the phagocytic index was lower in the low birth weight group. Finally, we could say that low birth weight induced by maternal malnutrition during pregnancy prejudices phagocytic activity of alveolar macrophages and could compromise immune response and increases susceptibility to infection. I would like thanks financial support was given by FAPESP, CNPq and CAPES. Thanks are also due to co-workers Noemi, Alexandro, Marina, Nathalie, Beatriz, and my advisors Richard Landgraf and Maristela Landgraf.